Hello, everyone. Welcome to the Pennsylvania Nutrition Education Network webinar series. We're so glad that you're able to join us today. We are going to be talking about the community hunger mapping and localized food insecurity and charitable food systems assessment. But before we get started, I'm going to introduce myself, go over a few housekeeping things, and then we'll pass it over to our great presenters. So my name is Camille Parks, and I'm the PANEN Director. If you're not familiar with PANEN, we provide education and training opportunities to SNAP Ed partners, nutrition and public health professionals all across Pennsylvania. So just a few notes before we begin, we will be recording this webinar. The recording and the slides will be available on the PANEN online learning management system, and we'll send out some information on how to get onto that LMS after the webinar as well. Please take a moment to fill out the webinar survey. The survey is required for anybody who is looking for CPEUs for continuing education credits. This webinar will have one CPEU in accordance with the CDR CPEU prior approval program. There will also be captions available. So if you need those, please use the live transcript tab at the bottom. The presentation will be about 50 minutes and we'll have a 10-minute Q&A at the end. So during the presentation, please submit your questions in the Q&A section on Zoom. And feel free to use the chat as well if you have any comments or anything that you want to share if things come to mind as they're presenting. If you do have any technical issues, please message a member of the PANEN team using the chat and we'll be happy to help you. So with all of that, please join me in welcoming our speakers for today. Julie Rhodes is Vice President of the Health and Nutrition at Community Action Partnerships Lancaster, and Zachary Zook is the VP and Director of Impact and Policy at the Central Pennsylvania Food Bank. This webinar will provide a framework of developing, implementing, and evaluating food security policies and programs through discussing results for community hunger mapping projects. This is an encore edition of Julie, Zach, and Dawn's presentation at last year's PANEN conference, and coming soon will be the 2025 PANEN conference. It's on April 21st through the 23rd in Bethlehem, Pennsylvania. You can register for the conference and connect with experts in nutrition education, gardening, agriculture, food security, and community engagement, and more. So if you like this presentation today, there will be similar presentations to this at our conference. So with that, I will pass it over to Julie and Zach.
Right. Good afternoon, everyone. Thank you so much for having us today and speaking about our community hunger mapping work, as well as much of the implementation work that has gone along with and accompanied this localized research that we've been conducting as a Central Pennsylvania Food Bank and as a charitable food system over the last several years. So just to reintroduce myself, my name is Zach Zook. I'm the Director of Impact and Policy at the Central Pennsylvania Food Bank. I'm really excited to be joined today by my colleague, Julie Rhodes at CAP Lancaster. She's the VP of Health and Nutrition. We've been able to work really closely together on community hunger mapping in Lancaster County and the implementation work on that front. And we also had the opportunity to, as Camille mentioned, to present this last year. Last year, when we presented our community hunger mapping work, we had only conducted this research in a couple of counties. And so now this year, we've completed this research in 9 counties across Central Pennsylvania. And so for those of you who aren't familiar with the Central Pennsylvania Food Bank, we cover 27 counties from Maryland up to New York border. And our goal is to complete this research in all 27 counties over the next several years. So that's just a brief primer on the research. I've updated some of the slides to reflect some new USDA data. And so even if you're at our speech last year, hopefully this is a little bit of new information today. Okay, so for today, we're going to cover 3 different high-level areas. So the first is, what is community hunger mapping? What does that process entail? and kind of how does that speak to the food insecurity situation in Pennsylvania. I'll also, as part of this section, go over national and statewide trends in food insecurity, which I think are really, really important to kind of grounding why this issue is so important and why it's going to take all of us to work to combat it. We'll then move into main findings and implementation progress. So far, there's been a lot of other changes in the last year, and we've been able to work with food policy councils all across our service territory and even at the state level to try to implement some of the findings and recommendations that we'll share today. And finally, we'll finish with the framework for effective food security policy. So we're hopeful that even though this research applies to the charitable food system largely, we're hopeful that you can take like principles and lessons from the variety of different things that we'll talk about. They're transferable really across industries and across sectors. So we're hopeful that no matter where you work or what community you're involved in, that this is going to be helpful information for you as you go about your work. So community hunger mapping overall, I just wanted to give a high-level overview of why we invest in this research as Central Pennsylvania Food Bank as a charitable food system. Again, community hunger mapping projects are localized food security assessments and charitable food system response. And we have three primary goals with community hunger mapping. The first is to center our neighbors. So really, we want to be able to make sure that we're making decisions with the folks that we serve at the top of mind. We want to build and put into place an infrastructure that will allow us to have continuous service improvement over the next many, many years to come. We also are really focused on building relationships. We know that an issue as big as food insecurity cannot be solved by one organization or even one network alone. And so part of our research, if you've been in one of our counties where we've done this research before, part of it is building relationships with stakeholders across the charitable food system and beyond as well. And then third, we focus on action. So a lot of our research is really in the weeds on data and a variety of different findings, but really we try to bring it all back to policy and programmatic recommendations. So every single finding, if you find one of our reports that are on our website, every single finding is supported with a recommendation and a policy and programmatic recommendation that accompanies it, because we really want to make sure that we turn research and data into action. Community hunger mapping, we have 4 different main sections. And so the first I'm going to go over as part of the food insecurity trends at a national and statewide and then localized level. We look at food insecurity analysis, of course. In the last 3 sections, we're really focused on how we can utilize each of these levers to reduce food insecurity in our communities. So we look at charitable and retail food access, and then utilization of key government programs like SNAP, WIC, school meal programs. These are incredibly critical to reducing food insecurity. And finally, as part of our research, we look into intersecting and upstream issues. So these are the economic factors that cause food insecurity. Before we get started, I also wanted to go into some definitions. So, and this will be informative as we review some of the USDA data. But looking at what food insecurity is, so food insecurity as defined by the United States Department of Agriculture is actually broken out into 2 different buckets. And so the first bucket is called low food security, and that is characterized by reduced quality and desirability as well as variety of diet, in addition to uncertainty around food access due to not having enough money for food. Very low food security is the most severe form of food insecurity, and that's characterized by all the things of uncertainty around food access, but also by reduced quantity of food intake. And so very low food security is the most severe form of food insecurity, and it's also our closest measure that we have to measuring hunger in the United States. And so as you'll see throughout our presentation, that's really a focus of our work going forward, how we can reduce that very low food security number. So looking nationally, this is updated data from the most recent USDA report that showed the national food insecurity rate increased again in 2023 from 2022. So if you look back 2 years, food insecurity has increased by close to 35% from 2021 to 2023. We expect that food insecurity rose again in 2024, but just based on a variety of economic indicators and visits to the charitable food system. But really just looking at the 2023 data, we know that food insecurity is an increasing issue. in the United States. And so that can be attributed to a variety of things, but the thing that I want to point out is that this 13.5% is in a non-recessionary time frame. And so you can see over the last 20 plus years, food insecurity increases dramatically between 2007 and 2008 due to the Great Recession and really stayed elevated. But right now we're in a economic situation where we have relatively low unemployment. And so the concern there is that even in a non-recessionary time frame, food insecurity has increased so much in the last 2 years, and we need to work to combat it. Very low food security, you can see on this chart as well. It's also near an all-time high at 5.1%. So that's 1 in 20 people in the United States who have to reduce the quantity of their food intake on a regular basis. I'll get into this a little bit over the next couple slides, but child food insecurity is higher than adult food insecurity pretty much across the board. And the really important thing to point out here is that food insecurity has never dropped below this 10% threshold. We got close in 2021, but it's never dropped below this 10% threshold in the entire history of the USDA measuring it. And what that means and what that indicates is that it's going to take more than a strong economy to kind of reduce food insecurity below that 10% threshold. It's going to take targeted, sustained public policy and community investments to reduce food insecurity below that threshold. So this is really trends breaking out by households with children. So one of the things that I want to point out here, that households with children have a much higher food insecurity rates than the overall population. But the really important thing to point out here, and we see this in our research as well, is that very low food security among children is quite low. So parents, and we've talked to many parents across central Pennsylvania who have expressed this experience, will work as hard as they can to shield their children from actual reduction in the quantity of food intake. And so they will eat less around dinner time or say that they're not hungry and go back after their kids go to bed and eat whatever is left, even if it's not enough. So while children are the most likely to live in a household that faces food insecurity, adults in the households with children are the most likely to experience very low food security. So I know that's a little bit complex, but I think that detail and that nuance is important as we talk about food insecurity going forward. Turning to Pennsylvania, we see very similar trends to the national level. We only have data up till 2022, unfortunately, but you can see really the jump from 2021 to 2022 mirrors what we've seen at the national level. There's more than 1.5 million food insecure individuals in Pennsylvania, and that includes more than 400,000 children. So food insecurity is a really big deal. More than 1 in 6 children face food insecurity, and 1 in 8 Pennsylvanians face food insecurity. You can see just the extent of this increase. What we can attribute this to is, of course, inflation for cost of food, but also the end of the expanded child tax credit, for instance, and that's happened in 2021 and it was expired in 2022, and we see this dramatic jump in food insecurity among children, much more than adults in 2021 to 2022, and we can attribute to that policy change. Looking at food insecurity by county in Pennsylvania, so just generally what this is intended to show is that child food insecurity is higher in nearly every single county than adult food insecurity. And so this map, nearly every single county has a food insecurity rate of 11 to 15% or less. But then if you go to child food insecurity, it's a bunch of yellows and reds indicating that the child food insecurity rate is more than 16% in these yellow and red counties across the state. And again, we'll make these slides available so that you can see your particular county. And this data is from Map the Meal Gap from Feeding America. So you can also look up additional details for your particular county or counties of interest in Pennsylvania. So turning back to community hunger mapping and our process, I went through these 4 main components earlier, but how we divide our research is really into 4 different steps. So the first step, and I'll go into some more detail on the next slide. The first step is really focused on secondary data analysis. We pull in data from a variety of different sources, from the USDA, from the American Community Survey, from the Pennsylvania Department of Human Services, the Pennsylvania Department of Health. We have developed a variety of analytical methods to analyze this data and apply it to localized levels, especially at census tracts and municipality and neighborhood levels across our service territory. And that helps us to understand a variety of things like SNAP or WIC participation, vehicle access, and other things like that using this secondary data. Step number 2 is our most intensive phase. That's really going out into the community and talking to people. We focus on folks who utilize the charitable food system. Over 9 counties, we've conducted more than 3,100 household level surveys. In Lancaster County, as Julie will share a little bit later, we conducted more than 750 household level surveys, which represented more than 2,000 people. So we have a ton of representation as part of this primary data collection and have a few other data collection mechanisms in place as well. That's, again, the most intensive phase, but in step 3, we combine these 2 first steps into triangulating our main findings and our results and compiling a full report that has the support and the evidence of both of these particular steps, and kind of triangulating the data in that way gives us more confidence in our findings and recommendations. Step 4 is implementation and evaluation. Of course, being part of the Central Pennsylvania Food Bank, we're committed to long-term reducing food insecurity in our communities, and that means being part of the solutions going forward. After we conduct this research in every single county, we're really focused on trying to continue to be involved, of course, through our core work of distributing food, but also through continued engagement with local food policy councils. And Julie will share a little bit of our development of Hunger-Free Lancaster County Coalition and some of the results there. So our data analysis, we have 2 different levels of data. The first is neighbor-centered data. So I talked about the household level surveys a little bit earlier. We also have done focus groups and extended one-on-one interviews. On the partners side, this means food pantries. The Central Pennsylvania Food Bank has more than 1,100 food pantry partners across 27 counties. So a lot of folks that we want to listen to and hear from their experiences. So we've conducted listening sessions, pantry surveys, and then in every single county, we have a consultative group of local organizations that helps us to understand the trends and variety of different things that we're seeing across counties. So I'm going to turn now to main findings and implementation. And so what was really surprising to us when we first conducted this research was the extent of very low food security among pantry visitors. Even after folks utilize the charitable food system, we found in Lancaster County, and really this has been found in nearly every single county, of a very low food security rate of around or greater than 40%, which is really staggering in terms of the percentage of pantry visitors who still report going hungry on a regular basis. And we asked this question as part of the 10-minute survey that we conduct. It's a 6-question USDA module on food insecurity. And so we have a lot of confidence in these results, but it's really just staggering how many folks continue to face very low food security, including a quarter of food pantry visitors who reported skipping meals or going hungry every single month over the last year. So that's a very big deal. We also found that there are significant differentials by household type. Not surprisingly, households with children are the most likely to experience very low food security among pantry visitor households. And really, I say not surprisingly because it aligns with the national data. So it shows that households with children of working age are also the most vulnerable in terms of likelihood of facing food insecurity. We really, after learning that very low food security was this high among pantry visitors in much of our service territory, have made reducing very low food security our North Star of our mission is to end hunger, and to the best way we can measure hunger is very low food security. And so our goal is to institute and encourage policies and programs that make progress towards reducing very low food security over time. So to that end, the 3 different other sections that we identified earlier, we speak of these as different avenues and factors in which we can leverage each of these avenues to reduce very low food security. So we'll talk about the neighbor experience and utilization of the charitable food system and ways we can use that system to reduce very low food security. Then we'll talk about SNAP participation in other key government programs, ways that we can encourage participation in that way and strengthen these programs to reduce very low food security. And finally, we'll get into upstream issues like household income and other economic factors. And what is our role to play? What is every other social service provider or other stakeholders' role to play in reducing very low food security through this mechanism? So on the first avenue, charitable food, we've found that the charitable food system reduces very low food security significantly in Franklin County, which I have shown here. Food insecurity, very low food security drops by half among folks who have utilized the charitable food system more than 12 times. So more than once a month in the last year compared to folks who have utilized the charitable food system 12 times or less. And this is holding income thresholds constant. So to try to make folks who utilize pantries at varying rates more comparable. We found this to be very consistent finding across every single county that we've done this research in. And what this indicates to us is that that more than 12 visits mark is we need to make sure that people have access to at least 2 pantry distributions in their area, or access to 1 pantry twice or more per month. And really that's how we can work to reduce very low food security through this mechanism of the charitable food system. And so to that end, we identified several different ways that we can improve as the charitable food system to make it so that people have access to charitable food providers when they need them. The first thing that we'll talk about is really leaning into what we discovered through our research is that many folks who utilize charitable food providers and food pantries view them as the lowest barrier social service provider. That means that they're often the first place that people turn to when they need help. And people also don't have a ton of paperwork or documentation requirements needed to access charitable food. And that gives charitable food providers a really unique role and responsibility to connect, to of course, like make sure that we maintain that low barrier status, but also to connect people to other resources if they're visiting charitable food providers at the first time that they need help. The other thing that we'll talk about is improving the neighbor experience. This is not tangential to the work of distributing food. Really, it matters how people are treated when they show up really anywhere, but also at food pantries, because it takes a lot of courage for people to utilize a charitable food provider in their community. And then coordinating a decentralized, wide-reaching system. The charitable food system, as I mentioned, in our service territory has more than 1,100 partners. And so navigating and really coordinating and working together across that many different partner agencies is, of course, a challenge. It's a challenge, but it also brings benefits in that we're able to really see great experimentation among food pantry partners, and really people are able to learn from each other and what works well, what doesn't work so well, and how we can work together to make things better for neighbors facing food insecurity. So some examples of leaning into the lowest barrier social service provider status. We identified several opportunities to do this. We identified this in many different counties, and there's different emphases based on the counties and operation. So for instance, in Lancaster County, we identified weekend and evening access as a really great opportunity to increase access to working families. In Dauphin County, we just published a report last month, and we found that really weekend and evening hours are really robust across the county. So that's not necessarily a place of a ton of improvement is needed. So it really depends on the county and the system, but we're able to identify these and work to increase hours of operation in the evenings and weekends to make it more accessible to households with children. The last example that I'll give there is that in Snyder, Union, Northumberland counties, we identified households with children as being underrepresented among charitable food providers and visitors, and recommended increasing hours of operation evenings and weekends. We've seen partners do that. And most of the new visitors are households with children because they simply hadn't been able to access the system before with more limited hours during the daytime. We also identified documentation requirements. It varies really by pantry, but some pantries have been asking for things like utility bills or proof of residence, or even birth certificates for children. And really these things are not compliant with state regulations. People are only required to submit and fulfill a self-declaration of need form, but really making that a consistent experience across the charitable food network is something that we've been working to implement from the findings of making sure that we are the lowest barrier social service access point, both in theory and in practice. We also look at geographic access, and as we'll get into some of the foods offered, the treatment of folks who visit folks who visit pantries, and we look at language access and pantry models. In Lancaster County, this is a map of Lancaster County, which I should have labeled for folks across the state. But one of the main things that we identified is that Southern Lancaster County there's a lot of work to do in increasing access, and I'm happy to report in the year since publishing this report, some of our partners in Southern Lancaster County have really worked to expand access across a variety of different ways. And so this map would not look the same today as it did when we did this research, which is really exciting and important. So looking at the improving the neighbor experience, one of the things that we measure in our surveys is reported feelings of judgment. Most people, I should say, report very positive experiences with charitable food providers. There's a lot of people across so many different communities in Pennsylvania who are doing amazing work in trying to make sure that their neighbors have access to food when they need it. So that is fantastic. But one of the things that we noticed is that there still is room for improvement here. We found that a sizable percentage of neighbors report negative experiences with the charitable food system. It can be as high as 10% in some locations, with some significant disparities by race and ethnicity. I have the example of Lebanon County here, but really this stands across many different counties. And one of the things that we found is that really every single interaction matters. When we do interviews with folks, they can point out particular negative experiences that they've had. It could even just be with one volunteer who's been having a bad day in one particular day. But we've heard from folks who have said that after a particular negative experience, they didn't go back to the charitable food system for several years, even if that meant going hungry. And so really every single interaction matters. And we need to make sure that we convey the importance and that we equip volunteers and staff to that effect. This is essentially, I went into much of this on the last slide, but one of the things that we've been working on in the last several months and over the last year is that it's important to equip pantry workers and pantry providers with the skills and resources needed to be able to make sure that there's a great experience when people show up to food pantries. That includes through training in culturally sensitive and trauma-informed care practices, but also in terms of how you build and how you think about the pantry environment. So we think about how do we reduce conflict points because moments of confusion or lack of communication are really where most of the conflict comes in. So having signs and availability in many different languages or making the pantry really just easy to navigate, all of that reduces conflict points and increases the likelihood that people have a good experience at a pantry. Pantry experience extends to the foods that we offer. And so in Lebanon County, we found that Asian and Hispanic households were the least likely to report receiving foods that they liked often or always. And so it was important to make sure that we asked and heard and implemented some of the foods that people were requesting as much as we could. Also happy to report that we did a follow-up survey at a pantry in Lebanon County, and they increased the percentage of folks from Asian and Hispanic backgrounds in their particular pantry who reported receiving foods that they liked often or always. That went up by about 15% in the last year, which was again really excellent. So just noting that it's always important to talk to folks that you're working with to hear their feedback and to help improve whatever it is that you're working on. And finally, my last slide before I pass it to Julie is that we also did non-food pantry surveys. So we worked with libraries and health systems to really understand folks who may be not utilizing the charitable food system. What are the barriers there? Really, the surprising thing we found is that among folks who screened positively for food insecurity, 33% reported not knowing where to find a food pantry. And so increasing awareness in that way is really important to making sure that our neighbors have access to the resources that they need when they need it. So that's it for me. I'm going to hand it over to Julie to talk about SNAP and utilization of government programs.
Thanks, Zach. So this is kind of the first part that Zach was going over is kind of the examination of the Charitable Food Network. And now we're going to move into sort of the key government programs. And we know that these are really large programs that help support food insecurity at the national level, and a lot of work that can be done there that can kind of help sustain families so that they don't have to end up at the Charitable Food Network. So So this is just talking about, again, building off of what Zach was talking about, that pantries are by and large trusted by the folks that are visiting them, and a low barrier. So it is an opportunity to think about how we connect folks to these underutilized government programs, because they are really critical to combating food insecurity and much larger than the charitable food network itself. So we really looked at SNAP participation, WIC participation, and child nutrition programs, including school meals. And we're going to go into a little bit more about SNAP here. And the report really examines all of those in more detail. So we're only going to talk kind of high level today about them. But we know that there is significant underutilization of both SNAP and WIC. And in Pennsylvania, we are not doing a great job in terms of our rankings in SNAP and WIC participation. And particularly, we were examining those folks who were at food pantries and their participation with these programs. So we were surprised, this is in Lancaster, we were surprised that of those who we surveyed at food pantries, 50% of them, 50% of them were involved in SNAP and 50% of them were not involved in SNAP, of course. And so we really think there's an opportunity here to think about, most of them are eligible. 85% of them are likely eligible for SNAP based on our information. And so there's really an opportunity here to think about how we really kind of address that. And then 20% of them have never even applied for SNAP, and likely they reported that they either thought they weren't eligible, didn't know enough about how to get into the program or how to apply, or, we know that these programs have a lot of barriers, unlike the Charitable Food Network, that, it's an application process, it requires a lot of paperwork. So these are things, we can think about an opportunity there that really, those people, we would love for them to apply and see if they're eligible for SNAP. And we know that the benefits of SNAP are real. And again, that those, for a lot of reasons, is the preferred choice by families, because it gives a lot of choice and agency to the family to also decide what foods are best for them and eliminate waste, and also kind of reinvest in the local economy. So a lot of good benefits there, and a lot of opportunities to think about how we connect pantry visitors to SNAP participation and other programs like SNAP WIC as well. Intersecting and upstream issues were key findings as well. So we know that food insecurity doesn't happen, mostly doesn't happen in a vacuum, right? It's a symptom of economic factors and poverty in our communities. And therefore, if we want to solve for food insecurity and hunger in our communities, we need to really look at these intersecting issues. And so the report really looked at housing insecurity as a place where families are making trade-offs. Of course, we know that rent mortgages are not flexible in the way that food budgets are flexible. So if you have to spend more on housing, you're likely gonna, feel that in your food budget. So these, not surprising, but there is a connection there, and a strong connection between eviction and those people who are food insecure. Financial inclusion, and so we did find that access to banking was limited among pantry visitors. So another opportunity to think about how we partner with banking systems and make sure that people are not underbanked or unbanked, those that are visiting pantry. And then finally, of course, income and low pay. We did find that people who are attending food pantries, most are working, and those who are not working are usually on disability, are not able to work. And so it's not that folks are not working, but it's, low pay or not getting the hours or regular hours, and they're earning less than 24K a year. So that's really low pay is the issue, not necessarily employment. So I'm going to talk a little bit about Hunger Free, which Zach mentioned earlier. So that is kind of our food policy coalition here in Lancaster County that has existed for 12 years. But we really used the hunger mapping report. Lancaster was the first county to undergo hunger mapping, and we already had sort of this coalition in place, and has kind of, reconfigured over time. This is kind of our third iteration of Hunger Free, and has looked different. We were at one point trying to think about community meals was a strong focus, and then COVID response. But in this third iteration of Hunger Free, we really been using the recommendations of the report as our roadmap. So it was really a gift to the coalition and really, marching orders for us to think about our work. So we have over 40 partners in Lancaster, and those include Charitable Food Network partners, but also lots of other kind of partners that social service partners that are connected to our work. And so our mission is to ensure sustainable access to healthy and appropriate meals, and then kind of thinking about improving pathways to short and long-term economic stability. So kind of looking more upstream and interconnecting issues. And you'll see on the other side of the slide here, we have 3 action teams that really, again, we're looking at the full continuum of food insecurity. So lots of times when people think about food insecurity, they're thinking about food banks, which is, the Charitable Food Network. And that's an important piece, but we really need to think about all the pieces working together. So Neighbors in Need is really around that Charitable Food Network, improving the neighbor experience at the charitable food and food banks. The second one is Path to Prosperity, and that's thinking about key government programs like SNAP and WIC, and then Voices of Our Neighbors is about advocacy, but we'll go a little bit more, talk a little bit more about each of those. So again, Neighbors in Need's the first action team that we have. So the work that we've been doing is really thinking about how we can transform the charitable food system to kind of be the ideal low barrier, trauma-informed, welcoming community for those who we're serving. And you'll see here, these are our kind of goals here, but the first goal is, and I'm excited to report that we've done a lot of work on this, but to develop volunteer trainings to help improve the neighbor experience at pantries. Here in Lancaster, we have lots of food pantries and varying levels of capacity in terms of staff, volunteer run, and the folks that are doing that work, and how can we really support them in making sure that they are trained and know what the level that we expect in terms of their interactions with neighbor experience. We know that people go into this, work with good intentions, but can inadvertently do harm if they're not kind of well-trained and supported in the work that they're doing. So we developed a series of volunteer trainings that are going to be free and accessible to our neighbors and the food pantries that we work with, so that they can kind of roll that out to volunteers and staff members that are working in the food pantry, so that really folks can have like a fundamental understanding of food insecurity and the approach that we want to take with neighbors. And then the coordination of food access barriers across the county. So, promoting best practices and communicating with each other. We do lots of work understanding what other pantries are out there and who they're serving and how we can kind of coordinate that work. Can go to the next slide, Zach. Thank you. So the second action team is Path to Prosperity. So again, this is participation in key government programs, and we really have been focused primarily initially on SNAP, just given the data that we found in the hunger mapping and the large reaching kind of nature of SNAP. And so we've been doing a lot of outreach and thinking about how we can connect SNAP and the food pantry network. And this year we actually started what we called SNAP Blitz, which is kind of a pilot program working at food pantries, getting trained volunteers who are familiar with the SNAP application system and know how to help neighbors work through that system and kind of get through some of the barriers that we know exist right now in terms of paperwork, how to fill out the application, what to expect, those types of things. So we trained volunteers and then kind of deployed them to food pantries. and kind of help neighbors work through that process. And although it was really a small kind of pilot this year, we had a lot of success, and we're going to continue to kind of refine that program and think about the training that we provide to both volunteers and kind of service providers around SNAP. And then this action team's also engaged in thinking about changes in upstream issues, and how can we connect with other partners that are doing kind of adjacent work, and how we can kind of make sure that our efforts are aligned. And this little chart here is just something that we use internally with our team. We think about kind of this continuum of crisis to thriving, and we want to really, meet families where they are in this kind of continuum, and make sure that we can help kind of support them moving more towards thriving as a community. So, of course, emergency food distribution. So the Charitable Food Network was always intended to be emergency support. We know that that's not always the case for families, that, some families are relying on that on a regular basis, but it was always meant to kind of serve a crisis point. So we really think about how we can move kind of more upstream and help families kind of be more safe or stable, and more towards that thriving. So at Crisis, we have the Emergency Food Distribution Network and Charitable Food System. Vulnerable, we work at our pantry, we have a resource liaison that helps connect families to other services, and how do they kind of, how do we serve other needs of families? And then at the safe level, we have programs like SNAP and WIC, and school meal programs that can kind of help stabilize, kind of more ongoing support for families. And then kind of moving up again is like addressing food deserts as a community, and how do we have culturally the right kind of food for families, not just enough food, but how is it the right food for their diets? And then thriving would really be, kind of the dream, which is, sustainable local food systems that think about food justice and the land connection. So that's really how can we kind of move our work towards that, and how can we work at all levels? We know that the Charitable Food Network is very important, but we want to make sure that we have strong supports at all of these levels to kind of move us to truly a thriving community. And then the last action team that we have is Voices of Our Neighbors. So this is really around advocacy, but particularly around how do we elevate the voices of those folks who are food insecure, both to the public and to policymakers, and how do we kind of as a network, how can we support that? So we are, thinking about, using our neighbor, how do we kind of have presentations, talking points, advocacy, perhaps like letters or advocacy points that we want to take on as a community, and how we can speak to that. And then also aiming to reduce stigma around resources, encourage involvement in combating food insecurity. So we plan to engage with local policymakers around food insecurity solutions. So we have, again, we've been kind of a year out from hunger mapping, and we have this coalition. So we have been seeing a lot of changes at the pantry level across kind of our county in terms of what folks are doing. Zach kind of mentioned this earlier, but some kind of large changes and some kind of smaller changes in terms of administration that really make a large difference for our neighbors. So we have had some pantries increase the frequency that they're doing distributions, which is really helpful. So, kind of expanding that, expansion into weekend and evening hours. Like Zach mentioned earlier, in the southern part of our county, we had a partner who opened on the weekends. So it was like, we kind of were able to work with them to stretch a little bit, and that's been a great addition. We've also been thinking a lot about how do we support Spanish speakers. If you can go back, thank you. And kind of how do we get Spanish speaking volunteers to help out pantries, because we know that can be a barrier as well. We've also been talking about reducing administrative burden requirements, talking with pantries who have long held, traditions of requiring additional things, and how can we kind of help them move from that to kind of continue to be low barrier. An adjustment of volunteer hours and pantry environment. And I'll talk a little bit more about our work at our food pantry and the work that we've been doing. So here at Community Action Partnership of Lancaster, we've been really thinking about how can we shift our mindset from sort of charitable food, charity, to thinking about how we can move to like more of a food justice framework and access adequacy and sustainability really being the kind of driving force of the work that we do. And so to help kind of support that, we did hire a director of food justice who's helping us kind of think through launching some new initiatives in terms of mobile markets and gleaning and food sourcing to kind of think about some innovative solutions. And then, like I said, Crispus Attucks is our food pantry here at CAP Lancaster. And so we really have transformed that experience, really with hunger mapping in mind. And we've really seen great progress in terms of what we've been able to do there and how we've been able to kind of continue to meet an increased need in numbers, but also the experience has been really improved. So that food pantry had traditionally had a long waiting line, like an outdoor waiting line that started very early in the morning. And so we really wanted to eliminate that kind of experience, and we moved to appointment-based. We are piloting a trauma-informed volunteer training and support for our volunteers. We have much more volunteers. We have moved to client choice. So it's much more of a shopping experience in our food pantry versus the traditional kind of food box system. We've also, we used to have very few volunteers that worked very long hours, like the whole day. And so we've tried to shorten our volunteer assignment times because also, you know, we know that people working long hours can also, you know, be stressed, and that can have an impact on the neighbor experience. We added a comfortable seating area. We also didn't have air conditioning in our food pantry. So that was a big improvement as well, and try to make it more comfortable in terms of the kind of environment that folks were seeing. And it really has like kind of, you know, when we lowered the temperature in the room, we kind of, you know, helped kind of improve the neighbor experience, and everybody's much happier. And I will also say that we have been really focused on language access. So our food pantry serves a majority of Spanish speakers. And we have done a lot of work on that. And we most recently have worked with an interpretation company to have an on-site interpreter for all of our food pantries. So that has been a great addition to the team as well. And then I'll turn it back to Zach to kind of pull us out here at the end.
All right. Sounds good. Thanks so much, Julie. And I should have added an after photo for that. Crispus Attucks transformation is really amazing in terms of what Community Action Partnership of Lancaster County has done with transforming that space and that experience for neighbors across Lancaster County. So I just wanted to go big picture here, and then we'll wrap up in the next minute or so. Really looking about what are the principles that we can take from this research, and how can you apply it to your work? And we put it into 3 different principles. The first being evidence-based decision-making. Just in whatever you're doing, it's incredibly important to make sure that there's a feedback mechanism for the folks that you're working with or serving, or in your customers, or in whatever capacity you're working at. So data collection on its own can seem really scary, but at its core, really what it means is just listening to folks and trying to understand their experiences and how their experiences can inform your work and make it better going forward. The second thing is really to center neighbors and to promote dignity, autonomy, respect, and choice. It's the most impactful policies and programs have these elements as part of them. For instance, the SNAP program is incredibly effective, and it has choice, dignity, and autonomy really built into that program. And that's what makes it so powerful in many respects, in addition to just the amount of food benefits that people have access to in some cases. So applications of this particular principle to the charitable food system, and you can apply it to your work, but for us, it's reducing service barriers, And it's making sure that everybody has the options and the types of distribution models that they prefer. So while we also want choice pantries, sometimes people do prefer a drive-through, whether that's for anonymity or for other purposes. So really having a choice between going to a choice pantry and a drive-through is in itself increasing choice, so that's another principle of application for us. And finally, what we found is that the folks doing the work are really the most uniquely and well positioned to informing policymakers about how a particular policy or program is impacting folks on the ground. And so really, as we talked about previously with food insecurity over time, it's going to take substantial state and federal investments to reduce food insecurity and to reduce it below that 10% threshold. And so using your unique position and your unique voice to make sure that policymakers have the information they need to make informed and public policy decisions that will reduce food insecurity over the long run. That is it for us. I think we came in enough time to have some Q&A here. I put our email addresses here as well. If you're interested in talking further, if you have any questions, we're happy to answer those now or via email.
Awesome. Thank you so much, Julie and Zach, for this wonderful presentation. We appreciate your inspiring work and your support with sharing these best practices with our network here. We did have a few questions that were submitted prior to this presentation that I'll ask, but if anybody else who's listening wants to ask questions, please feel free to use the Q&A section on the Zoom here or even pop it in the chat. So I believe as part of your presentation, you had mentioned that about 33% of people don't know where their food pantry or food banks are. And one of the questions was, is there still a map of various regions within Pennsylvania that show where the food secure populations are and where they could go to obtain the food? And if you guys know about that map.
Yeah, so right now it's a little bit disjointed. So it really depends on what system you're trying to navigate. I mean, PA Navigate is one of the systems, but also 211. And then on the Central Pennsylvania Food Bank website, for instance, there's a Find Food resource. If you go to we are one of 9 Feeding America food banks in Pennsylvania. If you go to other food banks across Pennsylvania, they'll have their own like Find Food app or website. We're really trying to work together to make it more of a one-stop shop for folks. And so what that looks like for us is really trying to make it much more widely available. We've been having discussions about how we can do that as a charitable food system, but then also contributing to those other bigger referral mechanisms. It's very complicated, and really trying to navigate these systems without assistance or without really word of mouth, like hearing of resources through word of mouth, it's unbelievably hard. And so that 33% number isn't really that surprising, but we're trying to work hard to reduce that over time. Julie, I don't know if you have anything to add there.
No, I would just add that, yeah, it's Zach said, it's a very disconnected kind of system. And so we're always finding, we're trying to always keep track in Lancaster County of the food pantries. And we're always hearing of small food pantries, popping up lots of places. And it's really hard to kind of keep, or on the other end, also closing, they don't have enough volunteers or support for it. So it's really hard to kind of keep grasp of that, especially if they're not part of the larger kind of Feeding America network and Charitable Food Network. So yeah, it's challenging, but it's definitely worthy of a lot of effort to kind of make sure that information is out there.
Thank you. Another question that we had was, what is Central Pennsylvania's food bank doing to replace possible funding cuts from the federal government? And how will this loss of the funds affect the other agencies serving in food insecurity?
Yes, it's a great question. So really my last point on the advocacy space, that's very important, just communicating the importance of these federal programs. We'll always do that. No matter the administration, we'll always talk about how important programs are that support food banks, but also SNAP, WIC, school meal programs. We're working through a variety of different ways, like the state budget process, for instance. there are two programs called the Pennsylvania Agricultural Surplus System and the State Food Purchase Program. We've put in asks to increase these amounts over the next year. And they were actually reflected in the governor's budget proposal. And so we're hopeful that that'll be solidified. Really, the federal funding cuts, I don't want to get too into the weeds here, but they represent a non-significant portion of our like food resources. So approximately 5 to 10% there, depending on the program. And so it's a huge impact, and we're working to mitigate that. Of course, through like also we purchase our own foods as well if we have private funding sources and those kinds of things. But it's definitely means that we can offer less food to less people potentially. And so that's a negative implication and ramification. But we're doing all we can to advocate and talk about how important these programs are.
I would just add to that, I would encourage organizations to kind of examine like all of their food sourcing and where that's all coming from, so that they kind of have a sense of like what's coming from the state, what's coming from the federal government, and try to advocate for those programs. Because I think, you know, it's sometimes challenging. You hear things at the federal level, but you kind of, if you can trace it back to how it impacts your organization, I think that's really helpful. And try to understand the impact. And, you know, we are lucky to be in a state that has strong state food purchasing program and other supports and a lot of advocacy that we can do there. And that can make a big difference in kind of when the federal supports are kind of, you know, uncertain at this point. So I think there's a lot of work that we can do in supporting those programs, and a lot of momentum happening in the state level. So I would just encourage people to kind of examine where things are coming from, and to kind of, you know, right now is a good time with outreach at the state level, thinking about the budget implications. So it's a really important time.
Yeah, if you're a charitable food provider, if you represent one or know of one in Pennsylvania, we're working right now to advocate at the state level for those two particular programs. That would go a long, long way to making sure we have enough food for folks.
Thank you, guys. So there's two quick questions here in the chat I hope to squeeze in. So Nan has asked about that she has also done a survey, and that they were wondering if you had done any work directly with Feeding Pennsylvania or Feeding America. And I believe the answer is yes. Don't want to speak with you, but you guys work directly with them, correct?
Yeah, yep. Actually, part of the survey we use is adapted from Feeding America client survey. And they are also a great resource, but also we've been able to share some of our practices and our research with the other 200 Feeding America network food banks across the country. So it's a two-way street, which is really great.
Awesome. And Denise was interested in the volunteer training and curious on if there had been any evaluation about any outcomes that have followed with that.
Yeah, so yeah, we're at the pretty initial stages of kind of looking at that volunteer training. It hasn't been rolled out yet. So I would happy to connect with Denise about the outcomes. But yeah, how we can kind of build that into the process. We're kind of at the early stages of that development.
That could be the topic for the next webinar you guys do. Thank you so much, everybody who was able to join us today. Just as a reminder, if you could complete the feedback survey at the end, I know our presenters and PA and EN would really appreciate that. Again, this is an encore of last year's conference presentation, so please join us in April for the PA and NEN annual conference. And if you guys are interested in this recording or these slides, they will be available on our learning management system. And if you haven't already, please join the PA&E listserv for more opportunities of webinars and other professional development activities. But thank you so much, everybody, and have a great rest of your week.